Well, first of all, you have to go back as to why we commissioned this report, why Treasury wanted this report to happen in the first place. And that was because, for the last 3 years, we've been dealing with significant overspend from the health service, particularly from Nobles Hospital. Many millions of pounds in additional funding has been claimed to be required, and there's been significant pressure on Treasury to fund more and more services in terms of health delivery across the health and social care spectrum. So we wanted to be absolutely crystal clear that we were in a position, one, to make sure that we were properly funding the healthcare on this island, because everybody wants that to be the case, wants us to have a best-in-class healthcare system, and secondly, that we were going to get proper value for money. And what Sir Jonathan has effectively said to us is, yes, you do need more funding. It is likely that that's going to be pretty significant, but unless you change the structure of the delivery of services, put in place a more modern, effective system, more governance around that, more accountability around that, better services in some areas for the nation as a whole, you're simply just going to be at risk of throwing more money into the service and not getting proper rewards for it. And he has said in his report that if we don't make those changes, if we just continue to put the money in at the rate that we're putting in it, then we're going to have a massive funding gap at £156 million in 2035.
Well,
so I welcome
the
report.
That you're right. That current financial trajectory, £156 million, is damning of government's actions so far. I mean, how's that been allowed to happen up until this point?
Well, I don't think it's damning of government's actions. I think we all have to take responsibility for a failure, really, to implement changes that have been highlighted to us in previous reports. We've had the aspiration now to deliver integrated care across the community for a decade at least, if not longer. And we've had, during that time of wanting to do that and that aspiration, failed to translate that into a proper context, failed to put in place the proper strategies and failed to deliver on those. And we've had reports from Beamans, we've had in terms of management, particularly focused around Nobles. We've had clinical reports in terms of concerns around clinical performance with the West Midlands. And finally, now we have a platform to make the changes necessary. So Jonathan, I think, is to be congratulated for the lengths that he's gone to investigate this, to get to grips with both public views in terms of seeking views from the public, and also the work that he's done amongst the clinicians. And one of the great things I think in this report is that he says there's some really great people in our system delivering good quality care despite the system that is around them, and we need to empower those people now across the board to get on and deliver the best quality care, the best in-class care, and get some proper accountability around that as well. And finally, you say about what makes this different. This makes this report different this time. Is because the recommendation and the desire is to get this transformation done outside of the day-to-day delivery of the Department of Health and Social Care, to bring that into the centre, led by the Chief Secretary as his recommendation. And we want to deliver that in a committed and timely fashion in line with the recommendations.
Well, we're talking budgets. It says instead of doing it annually instead of budgeting the health department every year, instead it should be a predictive budget for 3 to 5 years. In 30 seconds, how feasible is that?
Well, it is feasible. Again, it's a recommendation that I welcome. There's a lot in this report to digest. The critical thing for us now is to properly fund the transformation team, the transition team, put that in place, get a clear programme in front of us as to how that's going to be delivered. And when we've got clear sight of that, once this builds through, we will do and have to make relevant adjustments to the budget and work out how we're going to fund the exciting recommendations that Sir Jonathan has brought forward, including, of course, that one that you picked up before with 24-hour air med care to get our patients off the island to specialist care in case of high trauma and emergency, for example. So there's a lot to digest and a lot to do, but we're going to get on and do it.